Welcome to Cups and Courage. Today's guest is Beverley. Beverley is an acupuncturist, researcher and author, and she's on a mission to increase awareness of cancer survivorship and the benefits of acupuncture with cancer survivors. Cups and Courage, the podcast. Hello, Beverley.
Hi.
Welcome.
Thank you. Thank you for inviting me. This is great.
Thank you for being here. I'm super excited. I think I've told you that a few times already. I'm quite excited about this conversation. So thank you. How are you?
I'm very well, thank you. Yeah.
Great. Enjoying the bit of springtime. It's
Isn't
a little
it
bit
fantastic?
We're getting a bit more sunshine.
I got my spring colours
I can
out.
see. So if people are listening to this in December, know that when we were filming it was bright.
Spring. We had daffodils.
We had bright. Without further ado, we ask all of our guests to bring in their favourite biscuits.
Indeed.
How much thought went into this for you?
Quite a lot, actually. More almost than anything else.
Really?
Yes, yeah.
Okay, here we go. Oh my God. They are fragrant. I can smell.
Aren't they wonderful?
Is that gingerbread? Is that ginger?
It's spéculoos. Yeah, so it's ginger, cinnamon.
Oh, I have never seen these before.
Have you never?
No.
Okay. So these are the real deal. So I chose these because my parents are Dutch and they emigrated to Canada before I was born. And my uncle used to send these over. And these are Dutch spéculoos. And you can get spéculoos is quite common now.
Yeah,
You get it in the little biscuits. This is the real deal. So the classic is the windmill shape and the windmill design. And I mean, these are amazing because I had these shipped over from the Netherlands.
I want to cuddle you.
And look how thick they are. They're not just thin, wispy little biscuits. So these are just fantastic.
Okay.
And I'll tell you something really naughty about these biscuits. My mum used to get them, and she used to make sandwiches with them. So white bread, butter, stick the cookie in between, let it sit for overnight, and it just dissolves, and it's completely decadent and not something that I would be recommending
as a health professional.
So we'll just edit that bit out.
Honestly, these are lovely.
They're fantastic, aren't they?
So you can't get these here. You can't get. So
you can get spéculoos biscuits here, but these are the real Dutch.
Right.
Yeah, these are the real Dutch ones.
Thank you.
My pleasure.
Honestly.
Yeah.
They're lovely. Okay. Those people listening or watching us, you're not getting half of the value right now.
They're fantastic, aren't they?
Yeah, brilliant. Thank you. Okay. So, moving on a little bit, away from biscuits for a moment. What is your definition of courage, Beverley?
I think courage is just being able to get up in the morning and face the day. I think with the world as it is, that applies to everybody. I think if you're a person living with and beyond cancer, you need a double dose of courage, particularly if you're going through treatment or just the aftermath of treatment.
Thank you.
Yeah.
Thank you. Great. Okay, so Beverley, you are here with us today, and can you tell the listeners and the viewers a little bit about who you are and the context of you and cancer?
Okay, so I'm an acupuncturist, first and foremost, really, and I've been an acupuncturist for nearly 30 years. I've been working with people with cancer prior to becoming an acupuncturist as an aromatherapist. And I'm also a researcher. So I worked at Mount Vernon Cancer Centre, which is a cancer centre on the northwest edge of London, for over 26 years, doing research into. We were investigating how you can use how you can use acupuncture to improve the quality of life of people who have been diagnosed with cancer. So I'm a practitioner, I'm a researcher, I'm an author. I have a book about acupuncture and cancer survivorship. I have a PhD. So in acupuncture, my PhD was about using acupuncture to support women with breast cancer who were experiencing treatment-related hot flushes. So I know quite a bit about hot flushes.
Okay.
So that's kind of who I am. I do a lot of work around lymphedema, which I know we're going to talk about. So and I lecture, I write, I try and. My basic message is that acupuncture is a safe, effective treatment that non-pharmacological treatment that people with a diagnosis of cancer can use at any stage of from diagnosis to all through the cancer pathway, and it should be used to improve quality of life and support people. It can be used in conjunction with conventional cancer treatment, and it's just, I'm very passionate about acupuncture.
Well, what got you into acupuncture? What was the thing?
I used to have a project, which was that every year I would try a new complementary therapy. And in 1995, I think it was just acupuncture. I just thought it's time to try it, which is a big step for me because I'm needle phobic.
Okay.
So it was at a tricky time in my life. A lot was happening and things like. My acupuncturist was wonderful. She was just great. And at the time I was working as an aromatherapist. I was already working with people with cancer. But I wanted to do something more medical, if you like, and so I discussed this with my acupuncturist, and we discussed various options. And suddenly I didn't know what I was going to do, and she looked at me and she said, "Beverley, have you thought of becoming an acupuncturist?" And 6 months later, I was studying acupuncture.
Wow.
So, and I still have acupuncture fortnightly.
Do you?
Yeah. So I'm a big consumer of acupuncture. Yeah.
Great. I love this. I love this because I have personal experience of, leaning heavily into acupuncture throughout my own personal journey with cancer. There is something I'm really interested about, which we'll come to as well, is that I haven't really looked at it in survivorship, past chemotherapy, past kind of supporting me through chemotherapy and radiation, actually, as someone who is no evidence of disease, but I'm on medication. Actually, I haven't accessed acupuncture as a survivor.
Really?
Yeah,
okay.
And some of that is a financial thing. But so I'm really interested because obviously you're talking about this is within the NHS. This is within medical kind of settings. So how I couldn't access that within, that was something I had to pay for definitely out of my own.
Okay, so I think that is still broadly the case.
Yes.
The NHS, when it provides acupuncture as a service, it tends to provide it while people are undergoing treatment.
Yes.
Some places make an exception and will, like for women experiencing hot flushes, then they will extend it sometimes maybe to 6 months after the end of treatment.
I didn't even realise during treatment, though, it could be accessed as something. I thought that
some
was
centres, and so often when people come to me and say, how do I find an acupuncturist? I say, the first thing you should do is check with your treating centre to see if they have it. And again, it's very rare that the NHS is providing this. It's so often the funding for the acupuncturists and many complementary therapies will come from charitable funds.
Understand. Thank you.
There are a few places where the NHS
that makes
support
sense.
It.
Thank you, because I was suddenly going, if someone's listening and going, right, I can access this, I absolutely do want to access it, but actually it does depend on the centre.
It depends on the centre.
But it also depends on kind of, that charitable side of it as well, being able to provide that service for individuals. I understand that.
But it's always good to look.
Yes.
Yeah. And of course, in the when these services are provided, they're very popular. So often there's a wait list.
Yeah. And it's tricky actually, because I think if people had access to acupuncture throughout, it might be controversial and probably not evidence based here from me, but actually we might see a significant shift in the amount of people that are requiring other services.
Well, yes, yeah. I think this is This is it's a challenge to research that,
Yes.
and to get the evidence for that. But certainly clinically, I think this is what we see, and often, as with all problems, if you head them off early, if you treat them early, then they don't develop into a big problem. Yeah.
It's like massage. Sometimes we go and get a massage when we've got a problem, but actually it's too late. If we'd actually thought it's not too late, but actually if you thought about it as a preventative kind of ongoing intervention, then the chances are you hit it before it becomes a bigger problem.
Indeed. Yeah.
Okay, so for people who are unfamiliar with acupuncture, who are going, I've heard about it, and Beverly's just mentioned needles. Well, I don't understand what acupuncture is. Are you able to give us a bit of an overview?
Okay, I should have brought some little needles in, and that was what I didn't think about that. No. So acupuncture is really it's the insertion of very, very fine needles, very into the body, but they don't go very deep. It's quite superficial, and there are various forms of acupuncture. I'm a traditional acupuncturist, so I follow a form that comes to us from China, where it's been practiced for millennia.
Yeah.
And so the idea is that, in Chinese medicine, they would say that you use the acupuncture needles to stimulate points on the body, and this changes it helps to balance the body. This is what you're trying, balance the energy in the body. There's an adaptation of Chinese medicine, which is called Western medical acupuncture, and they would say that when you insert a needle into an acupuncture point, what you're doing is sending a message to the brain, and the brain will send out a cascade of hormones and chemicals that will help to improve health.
Reach a bit more of a balance things
out.
Yeah. Thank you.
Yeah.
So when I first had acupuncture, in my head I didn't know what these needles were. I had images of people with needles in their face,
there's that very famous one.
Your brain goes, oh gosh, but actually it wasn't like that for me for quite a long time. But it was about other things. But it was all around. My abdomen, actually my feet, my hands, my shoulders, lots of different things.
Yeah,
so I went early, before I was in chemotherapy, but when I was first diagnosed. And it's really hard to explain the impact, of something like that. But I think for me, just laying down quietly, I'm actually getting a little bit...
You are, yes.
Because I was being prodded and pushed in lots of different other situations, clinical situations, and lots of people kind of standing over my body and going, what is? I was, I'd lay flat, at my acupuncturist, and she just knew, she would look at me and I would tell her very little information, and she would just check whatever was going on, but she just knew, and she would do it, and then she'd leave, right? And sometimes I would be crying, just start, and I wasn't emotional before. It wasn't that, but there was a real sense of release. And it's quite hard to explain. I'm finding it quite hard to explain the impact of that. But I know I definitely, that when it came to chemotherapy, I had increased the amount that I was seeing her. So it become more regular to try and just bolster my body, really, and get me as stable as I could, to deal with the things that were coming. And actually talking about it now is probably the first time I've spoken about that. But it was through COVID, really, to the latter end, my radiation. So just before that, and then I think I stopped because of COVID, and then you think you're fine, don't you? You kind of go, everything is fine, and I deal just about okay, fine. I'm not sick, but I do. Talking to you, it's made me go, I think from a survivorship perspective, I've never really looked at it like that, probably because I look at it as an intervention when you're poorly, as opposed to what you're talking about around promoting wellness.
So there's many things I want to say.
Thank you for listening.
I
wasn't expecting to say, so
that's
thank
okay.
you.
I think the first thing is to address the needle thing. And in the research that I've done, many breast cancer patients, many women with breast cancer say, I don't want a therapy that has more needles.
Yeah.
It's nothing like the needles, like the cannulae and the needle and blood test needles. These are very fine.
Yeah.
We're not going into veins. We're not going deep into the muscle. So it. And I have a very gentle touch, so it shouldn't be painful.
Yeah, I agree, and I think that's definitely because it is very superficial. It's not. There's no pain. There's not pain. You know.
So that's one important thing. I think the other is that idea of acupuncture giving you that space, and giving you that space away from if you're undergoing treatment, it gives you that time out, if you like, from treatment, and that relaxation, and sometimes complementary therapies get dissed because they're just relaxation, but that is what you need. That's what helps the body to heal itself. So that I strive to create an environment where the people I see get profoundly relaxed, because I feel that's really, really important.
For your body to be able to do the things that it needs to do to get you back to
Indeed, yeah. And then the third thing is about that, having acupuncture after your active treatment ends. That point where treatment ends, in my book I write about it, in when I lecture I talk about the cancer survivorship pathway. I think I said the public perceive that cancer treatment ends when you ring that bell, or when your last radiotherapy appointment is, and that your treatment might end there, but the experience doesn't end. And so often I have 2 clinics that's although I treat people at any stage of the cancer pathway, I really focus and specialize in treating people post-treatment, because that's often, and for certainly the first year after treatment ends, can be really, really difficult for people. That first 3 months when they're, suddenly they're not being treated anymore, but they don't know how the treatment has reacted, it's really, really difficult for people. And so I get a lot of people coming to me in that first year after treatment with really challenged by anxiety, fear of recurrence, depression, so the emotional side, as well as whatever physical symptoms they might be having that are a consequence of their cancer treatment. So I think it's really important that we discuss this, that we open out the discussion, because many people think that they should be getting back to normal immediately treatment ends. And then they think there's something wrong with them because it's, they're fatigued, they can't sleep, and they're worried. So we need to have this open discussion that stuff isn't going to go back to normal right away. And also, in my book, acupuncture is really helpful for helping people to get through that difficult period.
It feels like there are almost 2 challenging parts there. You've got public perception based on whatever somebody's experience is, or whether or not they think a complementary therapy is, substantiated, or what the benefit for them. So whatever their own perception of acupuncture is. But then you've also got the education piece within the health professionals, the almost handover piece, because my experience is, probably like quite a lot of people, as you say, after active treatment ends, there might be some touch points, but there's no real fluid handover in terms of, right, this is your part, this is your survivorship now. What does that look like for you? Because for much of us, many of us, we it's a bit cold turkey sometimes. You go from having all these appointments, and actually, where's the bridge? Where's the bridge that says, now the recovery starts, now the healing starts, the healing that is not the same as your 6 weeks before you can drive, right? The deeper cellular healing, and the emotional healing, and all of that, and the care. And actually, wouldn't it be wonderful if the medical professional profession, really were signposting and going, what does this look like now?
There is, in the UK, the NHS has something called the recovery plan, and the aim is that every cancer every person treated for cancer has a recovery plan. But I'm a bit out of touch with it, and I don't think I'm certainly not meeting people who are conscious that
I think that's
what's
it.
happening.
If it is a recovery plan, it might be an internal pathway that, from an MDT, we go, this is a person, what's their next steps in terms of those things. But in terms of the actual holistic, individual, that's not language. And again, I can't speak for everybody. But we don't say, this is my recovery plan. So no one's necessarily talking to us like that, maybe, So it might be going on behind the scenes, but there is something lost in translation, which is,
Maybe, And we still, I'm still seeing a lot of people come to me who go to their oncologist, to their oncology healthcare team, and they say, I'm experiencing these symptoms, and they're told, well, that's normal, that's going to happen, and that will go away after a year after the end of treatment, and that might be the case.
Sure.
But why suffer? Why should people suffer with that for that year? And for some people, it doesn't end after a year. Some of these things become very chronic. So I think it's really important that, I always feel like I'm the deliverer of bad news, particularly when I'm talking to people who are on treatment. Yeah. And the focus when you're on treatment is getting to the end of that treatment and believing that life is going to be back to normal there. And so it's often difficult for me to say, well,
maybe not.
Maybe not. But we need
more. I don't know if it's education, awareness, more noise, more people, advocating for it.
So this is why it's great for me to be here to talk, because it's an outlet to educate.
Yeah, absolutely.
Make people aware.
Of the benefits. But for me, I'm a massive advocate of acupuncture, and even for me, to understand this, I don't mean even for me, I don't have all the information. I don't. I only have my experience, but for me, it's really interesting as well. Can we talk a little bit about lymphedema now? Because you mentioned this is something that there's a lot of passion and within, and if you could just give a little overview of, what is lymphedema? So some of our listeners might be familiar with that term, some of them might not.
Okay. So lymphedema is a chronic swelling of an area of the body, okay? And it's visible. It can be visible swelling. It's what we call a progressive disease. If you don't catch it early, it's like everything else. If you don't catch it early and you don't treat it properly, it will continue. So I was first aware of lymphedema back when I was an aromatherapist, and there were hardly any lymphedema services in the UK, and the oncologists would send their women with lymphedema to me for treatment, and I knew it was an inappropriate treatment, that massage wasn't the right treatment.
Okay, yeah.
And so that I think that ignited my interest in lymphedema. And so there's various forms of lymphedema. People can have a genetic disposition to it, and that's called primary lymphedema, or you can get something called secondary lymphedema, which is the result of some kind of damage to the lymphatic system. So cancer and its treatments, particularly cancer treatments, can predispose a person to developing lymphedema. About 1 in 7 people treated for cancer will develop lymphedema. And what we know most about is breast cancer-related lymphedema. So this is when the arm on the treated side begins to swell, gets very heavy, the skin gets very tight, and that just keeps progressing unless it's seen to. And it's very uncomfortable, it's very unsightly, and it predisposes people to a potentially life-threatening condition called cellulitis, and cellulitis is quite dangerous. That needs immediate treatment. Yeah. So I'm very keen on so most of the research and most of the attention has been on breast cancer-related lymphedema, and again, it's something that we need to spread awareness of because it's a potential well, it is a
It's a big
potential
risk,
consequence
yeah.
of cancer treatment.
Yes,
Yeah,
understand.
yeah.
And it's also why, so for people that are sometimes told you can't take blood on this side, or
Yes,
you
yeah,
can't
indeed,
have
yeah.
any, because any kind of trauma to that
Yeah.
affected side can
Predispose them
Absolutely.
to further infection, yeah, to
Absolutely.
infection, yes.
And you're right. I think there's not a huge amount. I mean, we hear about it, so you might get literature that you can read about the risks of lymphedema. But there's also things that you can read about lymphatic drainage, massage, and stuff, and actually not understanding it enough, and
Yeah. So it's a complex area.
Yes.
It's a complex condition. There is a society. There's a professional organisation called the British Lymphology Society, which is the organisation for professionals, and they do a lot of free information. About lymphedema. That tends to be directed at healthcare professionals, but it's also accessible to patients. So if you go to their website, the British Lymphology Society, go to their resources section, they do some nice fact sheets that tell you what lymphedema is, how it can be managed. So a person with lymphedema can understand more about their condition and why it's treated in that way.
And also maybe identify those early stages.
Yes, because it's so those early stages are a feeling of heaviness in the limb, things swelling, so not being able to get your rings off would be maybe an indication, a bit of altered sensation or a bit of change in the skin texture. And with breast cancer, what they're finding is that there is now more frequently people are getting breast lymphedema.
Okay.
So again, so pain and difficulty getting your bra on or something like that, swelling around the breast.
Yes.
If a person is experiencing that, then lymphedema services were always rare in the UK, and since COVID they've become rarer. But try to get that seen by a lymphedema specialist, and the BLS is really working hard on, British Lymphology Society is really working hard on doing education and awareness programs for healthcare professionals, because it's been what we call the Cinderella of conditions. It's been ignored. It's not been seen as important, and so there needs to be more educating of not just the public, but of healthcare professionals and the NHS about provision of services, appropriate services for people with lymphedema.
And I think it's from a patient responsibility as well. It's really about understanding your body, understanding those feelings, and what is normal for you after treatment. Because I know, for me, definitely, I had a lymph clearance on this side, so I can't have anything on this side, but there's numbness, where there wasn't before, and actually sometimes I can confuse that for a difference in sensation, which might make me go, oh. So if I do have that and it's pronounced for me, I'll wear my compression sleeve, so I'll do that because it's not going to do any harm. So for me, I go, right, well, I'll pop that on until things calm. But I think it is really about getting to know what your body feels like and understand those, as you say, those early kind of warning signs.
And I think if someone doesn't have a diagnosis of lymphedema, and it's certainly, there's the whole issue of what being at risk of lymphedema means. But being confident enough to express that and take that to a medical professional and have it looked at and assessed to rule out any to deal with it appropriately. And again, it's that message: early identification is key to good management going forward.
How do you so if we're linking that back to acupuncture, if someone's come to you and they've been diagnosed with early stage lymphedema, or they might be concerned because that they have this feeling, how do you, in my head we go, oh right, all the needles need to be in that area, but I would understanding the body as a whole, that's probably not what happens.
So I'm a big advocate of using acupuncture in the supportive care of people with lymphedema. And I've done a couple of research studies on that, and the wonderful thing about traditional acupuncture is you don't need to treat the area. We have what we call distal points. You can treat the other side rather than the side. We have lots and lots of techniques, so you don't have to needle the arm.
I would imagine, because that's the beauty of traditional Chinese medicine. It is, my understanding, is so holistic, right? So one thing will impact another, and it's to do with the meridians and the energy lines, and
indeed,
and so actually you don't need to focus on the axis. You said.
No.
Okay, so if someone is listening is thinking, I really like the sound of acupuncture, right? Those benefits,
because
right
it's great.
Up my street,
Acupuncture's
right?
Great.
Right, it's time
feels
to relax.
Good, doesn't
it feels
it?
good. It doesn't hurt, and actually, I feel there's a shift afterwards, and whatever. But I'm worried. I don't know what a session looks like. What can I expect? And I know you can't speak for everybody, but you are very senior in your positioning within acupuncture. So I wonder if you can just give an outline of what a session might look like.
So generally, what I do, and what we take a case. Take a kind of thorough case history of a person. We want to understand how the energy in that person's body is working. So we'll ask about sleep, we'll ask about appetite, we'll ask how the bowels are moving, we'll ask about urination, we'll ask about physical activity. For women, we'll ask about their gynecological history, and we'll ask about their past medical history, what they're experiencing now, and that gives us, we'll look at their tongues because that gives us information. We'll take the pulse because that gives us information, and so we're trying to get a kind of 360-degree look at a person and their energy so we can understand that. And we'll take that information, we'll make our diagnosis, and from that we'll draw up our treatment plan. What I do as a first treatment, I give people a very simple treatment, particularly if they haven't had acupuncture before, so that they can experience what having acupuncture feels like. They can experience what having acupuncture with me is like, and they can make a decision whether they want to go on. And that gives me a lot of information about how they react to treatment, and then we go forward. We usually say acupuncture is a process. It's not a magic bullet. One treatment isn't going to fix all your problems. So we usually say to plan on having 5 or 6 treatments in a row, ideally on a weekly basis, and then you'll start seeing the difference. I usually find that after about treatment 3 or 4, people really start noticing the difference, and you're really starting to get to the nub of the problem. And then you can take it forward, and we have a discussion, do you want to continue? Do you want to keep coming weekly? Should we start spreading it out so that you can come fortnightly for a bit and see how that goes? But it's always, I regard it as a team effort. So I am part of I work with the patient to help them have a better quality of life.
As you're talking, I'm having a hot flush.
Okay.
and I'm thinking maybe it's worth me coming to you, right?
And
going right, because these, joking aside, it's going. But that was a bit of a. But actually, survivorship for someone who's been through breast cancer, who's had some, much of the time, their hormonal system has been disrupted, and so from an estrogen perspective, and that they might be having hot flushes, they might not sleep, there might be some real menopausal symptoms that actually acupuncture can directly influence. And so, thank you. I thought I'd acknowledge it before you look at me and go, "You're turning slightly purple." Or if anybody's watching, going, "What's happened to
all the time?"
but it is. These are real things that we live with, and to your point, you can live with them, and they might kind of settle in their own time if you don't do anything with it. But if it's a bit limiting, you don't have to.
Yeah, and I've met certainly women and men, because men get hot flushes too, with very distressing hot flushes, and this is ruining their quality of life and their ability to function. And when I was doing my research, it was interesting that for me, I knew that that this was a common thing, but individuals don't know it's common.
Yeah.
And you know, some women came and they just thought they were horrendous monsters for having these desperate symptoms. So they were quite desperate and quite distressed by them. And, you know, that should not be that, you know, they should.
Yeah.
Yeah.
I get it.
Yeah.
And we don't have to suffer
You
in
don't have
silence,
to
and we
suffer.
don't have to,
No,
yeah.
No. And it's, you know, it's not always that acupuncture will get rid of every hot flush that a person has, but what we want to do is make them less bothersome.
Yeah.
So that you can function, so people can function, so they can sleep, so that they can go about their daily activities and
Yes.
feel well. Yeah.
I remember I was very, very anti-Western medicine at birth. So I've had a few diagnoses. So I've had a couple of recurrences as well as a primary diagnosis. And at the beginning, my mindset was very much like, I'm not going to have any Western treatment, right? That's just going to make me sick. You know, that was my this real strong narrative that I could heal myself with alternative therapies and I went to see an acupuncturist and I kind of went in and I said, I'm not having chemotherapy. I'm not going to do it. I'm not going to. And she, I think this might have been in my first recurrence actually, maybe somewhere in there. And she said, I won't treat you if you ignore medical guidance. And she was a Chinese lady, you know. And I remember thinking, oh, if you won't treat me, there might be something here. I might have to broaden my narrative around, you know, what I think I know versus what, you know. Because she's saying, this is not going to cure your cancer, but this will get you in the best place possible to be able to cope with what is coming ahead, right?
What good advice you received. You were very lucky.
So good, because I was quite bullheaded as well at that point.
Yeah.
And someone else spoke to us about their version of courage, and I think they coined it as, you know, accepting. I'm going to paraphrase it, but it's being okay to say I don't know everything, and actually what I thought I knew, I know differently now, and I can shift all that. I don't have to be stuck in this is what the right thing is.
Yeah.
You know, it's being brave enough to go, what I knew yesterday might look different tomorrow.
Yeah.
But yeah, so I remember, you know, I ended up have chemotherapy, and but her premise was absolutely this is a supportive thing.
Yeah. So, and that's thank you for raising that point. So I want to make it very clear.
Yeah.
There is no evidence that acupuncture is a cure for cancer.
Yeah.
But the evidence is that it is very good in the supportive care of people with cancer, and it can help mitigate those side effects. It can help. I mean, I think one of my teaching points is that acupuncture helps people to develop the resilience, and often I think what I give some patients is just the ability to get up the next day and go through with the next treatment.
Yes.
And sometimes that is the gift of acupuncture, just to keep getting them through that vital life-saving
And we're talking
treatment.
physical resilience here as well, aren't we? When, you know, this
Physical,
is about the physical,
mental,
So because sometimes when we talk about resilience, we're talking about this intangible, but you know, emotional kind of behaviour. You know, but actually, what we're talking about is getting your body as strong as possible when it is getting hit with a sledgehammer from every single angle. So, I mean, I'm a huge advocate, and it's making me want to
have an acupuncture treatment.
Well, just give you a call, basically. Right, so look, we're sat here with this book, and I don't want to, you know, a beautiful looking book anyway, and actually, you know, Acupuncture and Cancer Survivorship, Recovery, Renewal and Transformation. When did you write this?
Well.
Yeah, I mean, it's fairly extensive, so.
It took me 11 years to write that. 11 years from the idea of writing a book to its actual publication. It was an awful lot of work, but it's being really, really well received and really well reviewed. It's the first peer-reviewed, evidence-informed book about using acupuncture to support people who've completed cancer treatment.
Yes.
So I'm looking really focusing on that post-treatment experience and how to help people recover, renew themselves, and there are many case studies in there. People often find that acupuncture transforms their lives. So that's a
I can
great
absolutely
thing.
believe that. And the reader, is this for the likes of us, as people with lived experience, or a clinical piece?
It's it's mainly written for acupuncturists.
Okay.
But I've had non-acupuncturists read it. So
yeah, there's
lay
stuff in there.
people,
Yes,
do you
please.
say?
Yeah.
And although they say it's a bit technical, the case studies are very illuminating, and I think they're very helpful for people to, if people are challenged with survivorship, they help them to understand that these are the challenges of survivorship, and that acupuncture can help them, and maybe if they're having acupuncture and it's not straightforward, it isn't straightforward, people.
Yes, yeah. Bodies
so
react differently, right?
So many things can happen,
So if you are an acupuncturist listening and watching this is an incredible book for people to get from a resource perspective.
And Chinese herbalists, but also oncology professionals should be reading it, because it will tell them what acupuncture can do.
Yeah.
So
Great.
And people with cancer, people with diagnosis can read it.
Absolutely, And we talk about taking responsibility for your own wellness as well. But also, if the clinical professionals actually got together in one room and realised the different, just the different conversations they can have by just moving away from their own bias sometimes, or their own professional kind of piece, just understanding the wider pieces can only be helpful. So best practice, pick this book up, read it. Get the, I can see that's 11 years worth of work. I really like reading about things like this, because I like to understand. I really like to understand. Some people don't, though. Some people just want to know, right? They just, you're going to help me? Great.
So, indeed,
So, Beverley, what are some of the side effects or symptoms, that you are seeing people come in with that are living beyond cancer?
Okay. Fatigue is a big one. Okay. And that is often during treatment, and it continues post-treatment. And this is the big one that health professionals will say, well, that will disappear in a year. And so that is often what people come in with. For people with breast cancer, hot flushes is the big one. So often they come in with fatigue, hot flushes, anxiety. That's a very common
little triplet
little package that people come in with. And of course, lymphedema, often people have, so that gives them another little, we call them symptom clusters, so they might have pain, discomfort, body image problems. Probably 99.999% of cancer patients, people diagnosed with cancer, may have sleep problems. So those are some of the very, very common ones.
And the sleep pieces can be absolutely debilitating.
If you don't have sleep, everything it just exacerbates. It's like a magnifying glass, and it makes everything feel worse. And pain is another problem. So you talked about numbness here, but some people have surgically related pain, or radiotherapy related pain. So those are some of the big ones that we see.
And then just out of interest, I suppose for me, are there key areas in the body that link to, I'm interested, from a science perspective, are there key parts in the body that linked to certain ailments that you might see?
That's tricky, because we take the diagnosis and we work with the diagnosis. So not every person with hot flushes would have the same diagnosis. Not every person with fatigue would have the same diagnosis of fatigue. So we work with that. But like some of the standard points that I use, there's a point here, which seems red, that's called yin tang. And this is very good for anxiety, for sleep, And it's when I treat, that's the first needle that goes in.
Yes.
Gives you that nice sense
Yes,
of calm.
I remember.
Yeah. I think what's there was something that I was going to say that you triggered, and has it disappeared?
Was it,
Again, it's this idea about, I think acupuncture is really flexible. So if you can't use a point somewhere in the body, I don't get too attached to certain points.
Okay.
So I've got a very interesting patient at the moment who is very traumatized by her cancer treatment, and she won't let me needle in her arms. So I need to, and so my usually I would flex to treating on the legs and doing some points in the ear. But she has a lot of jewelry in her ears, so that rules that out. And last week she came in and she said, I don't want to be needled in my legs this week.
wow. Torso.
So this is a challenge I could rise to. And, I treated her on the center here. So it's very adaptable.
Yes.
I wouldn't say that there's points, but often what we do is we help. Something I forgot to mention before in a treatment, we work a lot with people on their lifestyle. So we give what we call lifestyle advice. So this is helping people to self-manage so that they can take on improving their own health and make adjustments in the way they're living their life. So often that might be around diet, which isn't just about what you eat, but it's how you eat it, sleep, things like that, drinking fluids, when to drink fluids, what fluids to drink, and things like that. And sometimes we do acupressure. We will show a patient how to do acupressure, and that is like acupuncture but without the needles.
Yes.
So a point here that's very common, if I just take my watch off, is pericardium 6. And so if you, to find that, you take 3 fingers, you measure from the wrist crease down, so it would be there. And I don't know if you can see, there's, you have most people have 2 little tendons there that run down, down the center. So it's not so easy to see.
Okay, yeah.
And so this is a point for nausea. So this is often, and maybe many of the audience have come across this. So you can press that, or you can go to Boots and you can buy C-bands.
I was going to say, there's the bands. My kids have had those when they were younger, traveling.
Yeah. And this point has been very well researched, okay, for nausea. But then I love acupuncture points because they don't just do one thing, okay? Yeah. So this can help with nausea, but it's also a point that helps with anxiety. It is also a point that helps with neck and shoulder pain.
Okay.
So it addresses the stomach. Yeah. This addresses, we would say it addresses the heart, and it addresses the shoulders. So this is the wonderful flexibility of acupuncture points.
And your body will respond to what it needs to in the moment. Yeah. So you're facilitating that. And just brilliant. Yeah.
Another thing that I do is we have ear seeds, and I don't know if you can see the little seed in my ear. Yeah. So this is on a point called Shenmen.
Okay.
And this is the gate to the spirit, is what it translates to. Okay. And this is a point that we use for anxiety, sleep, emotional fluctuations, things like that. So I'm revealing too much about myself here and describing why I've got this.
That's brilliant.
So this we can put on, and it just I call this an aid to gracious living. It's not necessarily going to cure anything, but for my patients with hot flushes, I say you can either just leave it there and ignore it, or if you feel a hot flush coming on, you could try massaging it a bit and just activating a bit.
Okay.
And so people find their own ways to work with these, and they're just a little tool to help things along between treatments.
Thank you. If someone is listening and they've gone, that's outstanding, I would like to find an acupuncturist. where do they
That
go?
would be great.
Yes, that's what we want,
Yeah.
but where do people go? How do they find someone?
Okay, so if you're on treatment, as I said before, the first thing is to check with your cancer centre and see if they offer an acupuncture service, because that's a good point of access. I am my professional body is the British Acupuncture Council, and so if you go to the British Acupuncture Council website, just Google British Acupuncture Council, then they have a Find a Therapist.
Okay.
Now, not every therapist is going to be someone who has expertise in treating people with cancer, but you can contact them and ask them.
Yes.
And the great thing about the BACC is that it is accredited by the Professional Standards Authority, which is a government body, which is, so it has a good reputation.
Yeah, great.
Yeah.
Great. Thank you so much.
It's been a delight and a pleasure. Thank you so much.
Genuinely, because
Yeah.
I knew this was going to be really, for me personally, because I don't think I've spoken about my acupuncture kind of experience before. So thank you for creating a space as well that we can have this dialogue. But I think it's going to be really, really valuable for people that are listening, whether they're someone with lived experience going through something, whether they're supporting someone going through something, or whether they're a clinical professional seeking to learn a little bit more outside of their own kind of field. I think there's so much value in this conversation. So thank you. And thank you for the windmill. It's been brilliant.
It's great.
Thank you.
Thank you.
Cups and Courage shares honest, personal stories of people affected by breast cancer. The views you hear are those of the guests and host and don't replace medical advice. If you're concerned about your health, please speak to a doctor or healthcare team. Cups and Courage, the podcast.